I'm very pleased to welcome Paris Goodyear-Brown, who's going to demonstrate one of her many wonderful techniques. Paris is a play therapist in Nashville, Tennessee. She's also the author of many books, chapters, and articles. She's a clinical consultant and trainer. So welcome, Paris.
Thank you.
So tell us about the technique that you'd like to show today.
Well, this is a technique called Lose the Bruise, and it was originally created for kids with negative self-talk. And it's very simple. You really just need a shield and a sword and some balls. And I'll give you the balls in a minute to demonstrate. So the child first identifies some negative self-talk. So it might be the phrase, "I'm stupid," that keeps repeating in his little mind, "I'm stupid, I'm stupid." So then we craft a replacement statement. And for negative self-talk, just giving the positive opposite isn't always effective. So if you, instead of "I'm stupid," if the child was to try and say "I'm brilliant," that may not work if the child's sort of a CD student. That's not going to be owned by the child. So once you have to come up with what's the right thing for that child. So for this kid, he might be good at math. So the replacement statement could be, "I'm good at math." So you then, the child gets the shield and the sword, the therapist gets the balls, and then the therapist throws the balls while saying the negative self-talk. And the child's job is to defend against the negative self-talk by saying the positive replacement statement as they are making sure the balls do not hit them. So that's sort of the biggest direction I give the children is be sure the balls don't hit you. And it's kind of neat because what you see happen is as they're using their words and their bodies together, they get empowered with, "Hey, I really can fight this." It's externalizing the cognition so that they can be wrestled with. And it's also kind of neat because they almost always end up using the shield to defend themselves because the sword doesn't work very well. You know, it doesn't have as much mass area to it. So then we can also talk about how defense is a better strategy than aggression. So, you want to try it?
Okay, yeah.
Okay, so you're going to say the negative self-talk statement before you throw the ball. So I have enough time to actually defend. And I'm going to say the positive restructured statements after that.
Okay, so
Well,
I'm like the therapist and you're going to be the child.
And I'm the child. Uh-huh.
Okay, so here we go. "I'm stupid.
I'm good at math.
I'm stupid.
I'm good at soccer.
I'm stupid.
I'm good at hugging my brother." So in this modification for anxiety, we would be looking at the child's negative self-talk in terms of what are the irrational worried thoughts that plague that child, and then we would come up with some replacement statements. And so, or boss back talk. With anxiety, you might call it boss back talk with the child. So if it's a perfectionistic child who says, "I have to make 100 on the test," then I might say, "I'll do the best I can," or "I'll try hard," or "I might make 100. Just the difference between I might make 100 and I must make 100 changes the pressure for the child.
Okay, let's try it.
Okay. So you say, "I've got to make 100 on the test."
I have to get 100 on the test.
I'll do the best I can.
I have to get 100.
I might get 100.
I have to get 100.
Nobody's perfect. If you're working with traumatized children who have lies that they were perhaps told by the perpetrator that they have believed now to be true, you can begin to wrestle with those lies in 3 dimensions with the Lose the Bruise activity. So if the child now believes it's my fault, then you can simply say, "It's my fault, throw the balls," and then I would be saying, "It's not my fault, it's his fault," in response.
It's all my fault.
"It's not my fault.
It's all my fault.
I didn't do anything wrong.
It's all my fault.
It's his fault." Right? So you boss it back. And really, I've been amazed at the way getting the full body involved, and they can feel themselves defending against the negative self-talk, empowers them to feel like they really do have some ways to fight back.
So it's a really visual way of them avoiding the hurt or averting the hurt by saying something empowering and positive.
Exactly.
Great technique. Great technique.
Thanks.
So for therapists who want to use this with their clients, what are some special considerations?
Well, one, just logistically, you don't want to hit the kid with the balls because the whole point is for them to feel empowered, and so you're pretty careful to be sure you're throwing them gently and really just in the spot where the shield is going to cover them. You're not trying to beat them at the game. Secondly, you want to have, and I usually use kind of the outline of a brain and fill in the negative self-talk statements in that brain, make a second brain and fill in the positive replacement statements in that brain, and then send them both home with the child so they can do it as homework in the yard. You do want to send those replacement statements home though, and have them at their fingertips when they need them, so they're not trying to create on the fly. They can use baseball bats and baseballs in the yard, or do something similar with a shield and a sword, but I do ask the parents to do homework with them where at least once a day they spend 5 minutes or so bossing back the self-talk, whatever it is.
Mm-hmm. So I love this technique, especially because it's so active and experiential and empowering for the child.
Mm-hmm. Well, thank you.
So thank you for sharing this wonderful technique. I'm sure it'll be useful for so many therapists and counselors out there working with children.
Thanks. Hope so.